Welcome to the Plastic Surgery Perspective.
Hello, everyone.
Cheers. We are so excited to be here with you guys. I am Ebony. I am the owner of the Unicorn Nurse LLC. And this is
I am Nurse Fonda. I am the owner of Nurse Fonda LLC. I've been a nurse for 13 years, I think. Woo, girl, a long time, right? And I've been doing post-op care for 3 years now. I started out doing post-op care, going to Miami, staying with girls in their hotels and Airbnbs. I learned a lot. I grew a lot. But thank God my clientele picked up in Atlanta. And so now I have a recovery house in Atlanta, and that is where I am currently located. So holla at me if you need me. My IG is nurse_Fonda_LLC.
okay. And I've been a nurse almost 10 years.
Woo! Okay, girl.
All right. Started from the bottom. Now we're
Yeah,
here.
okay, hello.
I was working in med surge at Grady Hospital. My background, I was a CNA for a couple years, so that helped me a lot through nursing school. But yeah, I also do post-op care here in Atlanta, and my Instagram is the unicorn nurse underscore, and then my business page is the Unicorn Nurse LLC.
Oh, how did you come up with that name? The Unicorn Nurse.
Because I'm a unicorn.
Ooh, okay.
Anybody
girl.
that knows me, know, baby.
We're not going to
know.
get into that. That's a different topic for another day, baby. That's not what we're here for. Okay?
That's not what we're here for. Let's get to the surgery, okay?
So our overall goal of the podcast really is to showcase some really great surgeons here in Atlanta, because we've heard so many young ladies reach out to us and they're just like, I didn't even know that there was so many different plastic surgeons here. I had no idea, that surgeon was located here or this surgeon. So we definitely want to create a platform where girls can come and make this a part of their research. If you're looking for a doctor, you're looking for someone to go to, they're going to be like, oh, let me go to that podcast. Let me look through some of these doctors and see where they're located, see what they're talking about, see their credentials. So that's our overall goal, really, is to make this a part of your research.
Yes. And also to educate, because we find that a lot of times we get girls that are very, very uneducated when it comes to plastic surgery. And we want you to be informed. That way you get the best results and also be safe, because that is a big thing with plastic surgery.
Most definitely. And, sometimes people arrive to the city and they think that they have it all covered. They think they're prepared, and they just are not. They think that their boyfriend or their grandma or their auntie can really get the job done. And they call us and they're like, hey, I need help.
My surgery's tomorrow.
Okay, hello. They're like, listen, I'm at the airport and my cousin not answering her phone no more. I was like, oh, Lord, okay, baby, I'm coming. But yeah, so we really just love what we do. I met Nurse Ebony we met on social media, right?
Yes.
Sometimes you have friends that you meet on social media, but she did my massages after I had my surgery.
Oh, baby.
Don't do me.
Get into it.
Don't do me, baby. I was a baby. Okay, them massages were no joke. I ain't even gonna hold you.
She was terrible, y'all. This is the worst client you could ever have, baby.
Baby, we ain't even gonna talk about that wood therapy. Baby, she still owe me about 15 sessions. But it's okay. I just keep the money.
That's facts.
I just keep. Don't even worry about it. But it's all right, though. You have to do what you have to do. But I was not a big girl, okay? I was not. I be telling my girls, y'all can do this. It's okay. They be like, is it painful? I'm like, girl, no. Whole time I was crying doing my massages. But it's all right. Oh, God. But that's why we are here, to educate and to provide you all with the knowledge that you need to have a successful journey, because it is definitely a journey. It's definitely not no overnight thing. You're definitely not going to come off the table popping it and, and looking all snatched like how you thought. No, it is a journey. There's definitely ups and downs to it. And that's why we're here, to provide a service, not just a service, but also someone that you can talk to, someone that you can call, and someone to really be there for you while you recover.
Follow me through thick and
Oh,
thin.
yeah. So some of y'all take it a little too far. No, I'm just playing. Call me anytime, man. Call. All right. So, anything else you want to talk about today?
Yeah,
What else we got?
we're gonna get into some IV hydration with Nurse Robin.
Yes,
I'm excited about
that's
that.
our girl. She definitely come through because sometimes some of the girls, after the surgery, sometimes you can definitely get really weak, really fatigued, because you lose a lot of blood during surgery, and sometimes you don't really hydrate properly before surgery. So, anytime my girls are down and out, I be like, Robin, where you at? She was like, girl, I'm coming.
And she comes.
And she definitely comes through. So we have our special guest here with us today. She's going to come and speak with you all. But just to let you all know that just want to kind of give y'all a little background about our podcast and why we started our podcast and the overall goal of our podcast. We're trying to be the Keith Lee. We're trying to be Keith Lee of plastic surgery here in the ATL. And then hopefully one day we can take it worldwide. You know. That's all it goes. We're going to start right here in the ADO and introduce you all to some
amazing
surgeons. We have some booked already.
Yes.
And they can't wait to come and talk to you all and tell you all about what they have to offer. Yep. All right.
Let's get into it.
Let's
text them. Oh, in the meantime, so hydration prior to surgery, a lot of times these girls, they starve themselves because they're trying to make weight. They won't drink as much fluid.
So
you're already going into surgery very dehydrated. So I always recommend make sure you're at that goal weight way before your date. That way you have already the proper nutrients and everything that your body needs because, baby, it get real.
And let me tell you, and nurses are the worst. Because that's exactly what I did. I waited to the last minute. I was over my BMI. I detoxed for like 2 or 3 weeks, and it caught up with me after surgery. Day 1, I was okay. Day 2, I was like, ooh, starting to feel a little weak. Day 3, I couldn't even get out of the bed. The IV hydration nurse had to come and see me at the recovery house I stayed in Miami, and she had to give me a drip. I'm talking, I could not even lift my head up. I was beyond weak, beyond sick. I had a migraine. I couldn't even open my eyes. It was horrible. And now I thought back, I was like, why would I do that? I literally
and you know better.
I know. Come on now.
All you know.
Nurses are the worst. We are the worst.
We are the worst.
I literally detoxed up until the day of like my pre-op. And then after I went to my pre-op appointment and got on that scale, and baby, they cleared me for surgery. Honey, I ate so good.
But you know what?
But they caught up with me. It was bad.
We do it to ourselves. We really do. And then even when I used to work at the hospital, I did not drink water how I was supposed to drink it.
No.
Because you're trying not to pee. You're trying to make sure people don't die. It's like, it's real.
Yeah, but as a nurse, I mean, you're always so busy. I'm like, I don't know how they want us to drink all this water. This is crazy. I can't. I'm busy.
And you only get 3 breaks. You barely get 1.
And I'm telling you, so with my full-time job, I do work for United Healthcare full-time. And being able to do post-op care, being able to meet girls from all over the world has just been amazing. I'm just blown away because they're all so knowledgeable. They all come from different walks of life, different backgrounds, different cultures. I've just learned so much from meeting so many people. And that's one thing, too, that I love about the post-op world.
Yeah.
Just meeting everybody,
It's a blessing because you end up really clients become friends.
Most definitely. Most definitely. So my makeup artist, hello. Shout out to Polished Faces. Okay.
We love you, Val.
We love you. Honey, let me tell you, she started out as I went to her a couple of times and then we ended up, she was like, oh, you a nurse. And I was like, well, yeah. She was like, oh, well, I'm having this done. I was like, okay, girl, I got you. And we've been stuck together ever since. That is my girl. But yeah, sometimes the clients, they become some of your closest friends. Yep. Love them to death.
Yep.
All right.
So what else we was going to talk about? Let's see. I need to get my phone, don't I?
Thank you. Kind of just flowing with it, right? We're just flowing with it.
So, okay. What is your pet peeve? Let's get into pet peeves. Just one. Just one.
A pet peeve that I have is when I hear a client say, "Oh, I've been doing all this research for a year and I've been doing this and doing that." And then they ask you something that's so simple. You're like, now you know you ain't done no research. What is you talking about? I think that's my pet peeve. Because if you haven't done any research and you did your surgery on a whim, just say that. Like, it's okay.
It's
'Cause
okay.
it is okay. But don't come to me like, yeah, I'm so knowledgeable and I've done all this research,
Yeah.
but what's lipo 360? Girl, what is
A lot.
What? Okay, it's all right, friend. It's all right.
And it's like, if you tell me you know a lot, I'm speaking to you as if you know a lot versus as if you're a beginner, because I base that on, okay, where do I need to start? If I need to start at, okay, you need to put these lipo foams on, baby, you ain't did no research.
Right. That's what I'm saying. I think that's what gets me. I would rather you be upfront and say, hey, I did the surgery. I probably did not do enough research. Can you help me? Like, tell me exactly what I need to do from day to day to day. As opposed to you coming to me like, yeah, I done did all this research and I know what I need to do. But then come down to it and you don't know too much of anything. You know, I'm like, girl, why I'm trying to research you said you did. This is crazy. But I think that's my biggest pet peeve. I think just making sure that you're upfront and honest with yourself and with your postdoc care provider. Like, hey, this is where I'm at in life right now. Right? This is what I know. This is what I don't know. This is how much money I have. This is what I'm working with. And I think you have a better outcome overall in general.
Yeah.
So that's my pet peeve. What's yours?
I feel like it's kind of the same because mine is education. So I'm really big on education, because I feel like the more you know, the better you prepare yourself and the less hectic everything will be, because people be thinking, oh, it's only lipo. They told me I could go back to work in 2 days and blah, blah, blah. Like, no, this is really serious. The better you prepare yourself, the better outcome you'll have. So I think that's my thing. It's always been education.
You know, I always laugh when people say, oh, I'm only having lipo. You do know that's the worst part.
That's the worst one.
Who told you that? I'm not getting a BBL. I'm just getting lipo. Lipo is the worst. So I don't know why you think why you think that's gonna be a walk in the park, because baby, it is not. The BBL part does not hurt at all. I mean, it's nothing to it. You just can't sit for 6 weeks. But other than that, the lipo is the worst part, honey.
Yes.
Yeah. But people always say that, oh, honey, I'm not doing all that. I'm only getting lipo. So I'm only gonna stay about a day or two. Oh, okay.
Yeah.
So that is the biggest, I think, one of the biggest misperceptions in the post-op world is that lipo 360 is the easy part. That the BBL and the tummy talk are very invasive, and and I don't want to do all of that. The lipo 360 is a lot.
Yeah.
But we're gonna go ahead and bring on Nurse Robin. Now, hey, Robin.
What's up, y'all?
Hey.
How you doing, baby?
How are you?
Good. These my girls, y'all.
Aw.
I love these women.
We know you.
We love you
but
too, girl.
We love you, yeah. But introduce yourself. Tell people what you do.
So I am Robin Butelis. I am a IV hydration nurse, the drip therapist. I own Rejuva Wellness Bar, so I go mobily to everyone's home, office, the call.
Okay.
Girl, I go everywhere, girl. And I provide IV therapy to make sure that everybody becomes their best self. Because like you said, after surgery, the girls be down. The girls be down and out.
Down
They be
bad,
down
baby.
real bad, and they think I'm not important, child. They don't think I'm important.
I know,
They tripping.
right?
They be tripping.
No,
So
they
they
be
call
tripping.
me.
They be tripping.
And so they called me like, can you save me now, baby? You should have been called me, baby. I would have had you right the day of surgery.
That's it. That's
Okay.
it. Trying to
So-
save a coin. Go on, get that drill.
Yeah, come on now. So I provide the IVs. The benefits of the IVs is to make sure that you are up for surgery. The day of surgery, you feel down and out. You can be dizzy. You can act like you're gonna faint, nauseous, vomiting. So my job is to make sure we prevent all of that. Y'all know lipo, BBLs, they take out about 1 to 5 liters out. So I make sure that I give you at least a liter back to get you up and not feel like you're gonna pass out. Also wound healing. Y'all know after lipo that those bruises, girl, y'all be bruised up, honey.
Don't they?
Okay. So the vitamin C helps lighten it. So over a day or two, it will start to disappear. So you know you don't look like somebody to beat you up.
Right,
Up.
most definitely.
Somebody look at you like, girl, what's going on with you? And then the nausea and vomiting part. So everyone's like, oh, I could just take my Zofran by mouth. Girl, how you gonna take that? You can't take no water down. You can't even drink water. And you talking about, yeah, I could take my girl, it's not digesting. So we provide nausea medication to go through the IV to make sure you can help with that. And then essential vitamins and minerals. So B complex, B12s, those are I call it, those are the kickers. That's what gets you up. That's what gets you going to make sure you're like, oh, I'm alive.
That's the Folgers.
That's the folder.
That's it.
You be like, oh, okay, I could see, I could talk now, girl. I don't feel dizzy, and oh, Nurse Robin, this you? Yeah, girl, I've been here the whole time, baby, making sure you good. So providing those essential vitamins inside the bag and that fluid. So that's basically like what I do.
Well, tell us a little bit about yourself. How long you been a nurse?
Oh, this is year 5. I'm the baby, y'all.
Oh,
I'm the baby.
it's okay, girl.
It's okay.
You out here killing
They
it.
say
Thank
nurses
you.
eat their
That's
young.
it. No, we not.
But
No,
we don't do
definitely
that.
not.
We don't do that.
No
we
way,
not on
Jose.
that type of vibe.
No.
No, you guys are amazing.
Oh, thank you.
So I was a trauma nurse at Grady. I did step down ICU and I did trauma, and that was my thing. So seeing blood and people passing out, child, it's nothing to me.
It's
you know,
nothing.
we've been used to that. So I've done that, and then I went into the wellness space after I had my daughter. IV hydration became a part of me because I couldn't eat and drink while I was pregnant, and they were like, "Hey, she's small. You know, you're not getting nutrients in." So the IV actually helped me go to full term
Okay.
with my baby.
Oh.
Yeah, so a lot of people don't really know that piece of it, but that's why I was like, I think I could save other people. Like, what if I can do this for people who look like me, especially Black women.
Yes.
We don't know a lot about the health side, and we're very nervous. I don't know, for some reason, about nurses, people sticking us, what you put in my body? What you doing there?
I had to see the label, baby.
But you know what?
Is it expired?
It's expired, but I get it. I understand. It makes sense. Like, you coming in my house, you sticking me, you putting stuff in my body, girl. What are you talking about? So I provide that level of comfort. Like, I understand.
But that's perfect. That's a perfect example because my daughter threw at 12. So 12 years ago, mobile IV hydration was not a thing. And I went through the same thing. I suffered from hyperemesis, which is I vomited every day for the whole 9 months. And I would get so weak, I would have to go to the emergency room and get fluids. So imagine how much that cost my insurance company, how many bills I had come into the house, because I literally would have to go to the emergency room and get fluids at least once a week, sometimes twice a week.
Yeah.
And it was horrible. But had I known, okay.
You would have did it,
Oh,
baby.
hello. If there was a Nurse Robin
Girl.
in Greensboro, North Carolina,
Come on,
12
baby.
years ago,
Come
baby,
on,
we
baby.
would have
We
been
would-
thick as thieves, okay? You would have been my best friend.
We would have been locked in.
Okay.
And then imagine, would you like a $200 bill or a $1,000 bill?
Right.
I know,
Because that's
right?
exactly what it was. And I would only be, they knew me by name. They come find them. Oh, God.
There
Here she come again. They like, come on back.
And then, you're in the emergency room. People don't talk about that process.
Yes.
You
Yeah.
have to go to the hospital. You got to go in the emergency room. Y'all know that wait about 2-3 hours.
Yes.
Just for
okay.
you to stick me for 5 minutes, throw this bag up, sit down, and send me on my way.
And they
That's
love
it.
to give you an EKG.
And if they know that you just had surgery, first of all, they taking advantage of you. They gonna tell you,
gonna run
we don't know what's going on. Oh, you're doing all this bleeding.
Oh,
Oh,
Lord. Let's run the bill up.
Whole
Run the bill
time,
up.
Run it up,
whole time
baby.
the hemoglobin low, and you need a little hydration. That's it,
They're gonna be
baby.
like, well, your hemoglobin is
Low,
at a
that's-
7. Ooh, you
Ooh,
right.
we gonna have to.
First of all, you just had
gonna have to
surgery.
give you a blood
Oh,
transfusion.
we gonna- So you can avoid all of that.
Yes.
Just call
Nurse
Robin.
And also for my anemia girls, those are the one that make me nervous.
Oh, most
Baby,
definitely.
you know you anemic. You ain't taking these pills and you about to have this surgery. Hold
Hello.
on now. You need to be careful.
Mm-hmm.
Okay. So we do provide iron infusions too, pre and post-op. Because a lot of them, they don't take the iron pills.
Right.
And I want everyone to be careful with that. They would say you can't have surgery, baby.
They will. Most
That
definitely.
day of, and they would take your money, And so you're going to have to reschedule for another day. So I suggest that you make sure you stay on top of that
You
lab
sure
work.
will.
Get that iron. Because
and you're not getting a refund.
And you got to pay extra.
Okay.
they don't talk about that. Come on now. All right. So I like to prevent a lot. I'm the prevention nurse.
Okay.
That's what it is. I like to prevent anything,
That's a great
any
way to put
habit.
it.
Yeah. Anything that happens. So we don't need you passing out. We don't need you vomiting all
Can't
over the
pass
place.
out at our places, baby.
No, we prevented everything. And this people think like they don't really need the IV. Like, oh, I feel good, I feel fine. You know, you had a client.
Yeah.
The first day
she
they
was down
they,
bad,
they walking
baby.
around that first day. Oh, I don't need that. I said, oh, watch that second day, that third day.
Oh, that third day,
That-
baby.
They be like,
Oh, yeah.
They call me. You got Nurse Robin number
Yeah,
again.
quick, right? What's that IV
Yeah,
hydration
the
nurse
nurse.
name again?
Send me her IG.
Right.
And that's the problem we're having in the surgery world. Y'all gotta stop waiting
To the last minute.
We gotta be proactive instead of reactive.
Hello.
Okay, we need to make sure that we get things on top. Just prevent. All my girls who prevent, y'all notice, all the girls who do what they're supposed to do,
Amazing.
they be like, oh, surgery was a breeze.
Yeah.
Surgery wasn't a problem.
Like we just had one girl where Robin came and she had already contacted Robin
Yep.
and stuff before she even got here.
Yep.
So a plan was already in place. That girl was up, walking around like nobody's business, walking 15-minute intervals, everything.
Come on now.
Amazing.
Yep.
And went home by her business. And a lot of the girls that come to Atlanta, they travel. So I tell everybody that too. You need to be safe. You're away from family. You need to be careful.
Yep.
This ain't Miami. I call Miami the chop shop.
Girl.
I'm from Miami, y'all. So
Preach
it's not,
on it.
I'm not throwing no shots.
And we
Preach
went
on
and
it.
we went to have surgery in Miami, so
Sure
it's no
did.
shot.
No,
no
hey,
shot.
no shade. Because listen, I sure took my tail to Miami. Okay.
Exactly. Shout
Hello.
out Dr. Cannon.
Okay.
Shout out Dr. Skurlock.
All right, and some of these girls are going to the chop shops. I call it the chop shop. They tucking and driving them, and then they ship them on their way. And y'all hopping on flights in 2-3 days. What is?
What is up? Not me, baby. Not me. I didn't do it, but not.
Well,
Father, what are we doing, Father?
I said, how many days did I stay in Miami? Oh.
Not the mama I got. Baby, you gonna have a setback.
I think I stayed 4 days. I did.
Okay, that's not bad.
No, that wasn't bad.
That's not
It
terrible.
wasn't-
No.
No, it wasn't bad. I stayed 4 days, but it was a struggle. I could barely even walk through the airport. Yeah, it was rough. It was rough. That day 4 was rough, but I mean, I made it. But yeah, I did. I went home on day 4.
You had that booty in there.
I did. I did.
That's the only way to do it.
The booty was in the airport.
The booty was
It's
there.
all right. It's all right.
I took me a Benadryl and then I got on the flight and I slept. But you know,
Benadryl?
it was on like an hour
My girl said she
from
gotta go to sleep.
Atlanta, from Miami to Atlanta. So
That's not that
I was
bad.
knocked out.
Yeah, but
by
a
the time
Benadryl for an hour.
I know,
Yeah.
I did, and I
You
had
woke
to
up
do
drowsy.
something. I did, but I needed it because I was scared, I was nervous, but it was fine.
That makes sense. I got you.
Just kind of help ease my nerves a little bit.
Okay.
But iron infusions. Let me ask you a question. So, how many iron infusions do you think someone would need, and how soon should they start them prior to surgery in order to really make sure they can meet and have, be up to like a normal within normal limits?
Range. So basically, what I would say, we need to look at their lab work. So let's get some labs first. So if you're low, like on the low end, let's do 2 infusions. You would be exact, even 1 infusion. All my girls who've done 1 with me, they got clear for surgery.
Okay.
And they had at least, and one girl made me nervous. She had 5 days before surgery. I said, Lord. And it
Oh,
takes, you need to do
man.
it 2 weeks, at least 2 weeks before.
Yeah.
Because
Oh,
that
okay.
takes time for your body to understand, okay, what's going on. So she was like, listen, they did not clear me for surgery. And I'm like, girl, when is your surgery? She was like, 5 days. And I don't do 5 days because that's just not enough time for the iron just to metabolize in your body. It just isn't. And I was like, she was like, can we just try? So girl, I had to do double dosage.
Yeah.
Had to get the doctor. The doctor said, okay, let's go ahead and do this to see if she can get cleared. We did it. They took her lab and went up.
Okay.
And then she said, we're going to wait till the day of surgery to give some more time because
Right,
that'll give
right.
us 10 days. I'm like, all right, cool. And my girl was at 12.9. We went from
Look at God.
we went to
Hello,
8.2 to
hello,
a
somebody.
12.9.
All
So
right.
that was, but I will always tell everyone, let's get the lab results. If you're extremely low, the earlier we started, the better. You will be ready because you can now do it with dieting and
Right,
you'll be
right.
fine. We have, the point of the iron infusion is to get you a head start, to get you up to where you got to go.
Right.
for after surgery, if you're automatically anemic, 1 iron infusion will be typically fine for you. But a post-op drip will help with that because it has B12. B12 helps increase the red blood cells in your body. So the iron infusion after at least 1. But if you're extremely anemic, with your lab results, we might have to do 2 infusions just to be on the safe side. I want you clear, but you have to give me 2 weeks. Please, nobody. Don't do that no more. Don't wait till 3 days before. Nurse Robin, baby. Oh, Lord. That's 50-50.
Yeah.
But I think that's the highly recommended thing I'll do. And then we need your lab results. Okay. I can't go off the whim. Yeah. Oh, yeah, I'm anemic. Yeah. How you know?
What that mean to you, girl?
And your last CBC was 10 years ago, baby.
I've been craving ice. I got to be anemic.
Girl, just be oh, yeah, I'm anemic. Ma'am, who diagnosed you? You know, my grandma, baby.
And then they be like, I got heavy cycles. Right. Then labs come back, you fine.
That's another thing. Doing iron infusion on your cycles. No. That's a waste.
Yeah.
It's a waste. So that's another question I ask. Are you on your cycle? Can you imagine having surgery in 3 days?
Right.
And you got to get a blood test. You got to do iron infusion and you bleeding out. Everything I'm putting in, you coming out.
Coming right out.
Yeah, so that's what I mean. If we have enough time to do what we got to do and get you clear, we won't have to really deal with it. Okay.
What other services do you offer?
So right now, I'm the lazy nurse. Y'all the hard. I call y'all the hard working nurses. These nurses. Let me know. I'm not lazy, but they massaging. They up with y'all.
You do a lot.
I know.
They up with y'all. I'm there for 3-4 hours. That's all they got for me. No. I gotta go to my baby. I'm sorry. That's all they got for me. I do my assessment. So that's what y'all see me. We do the assessment, see how they're going. You let me know, hey, this is Robin, this is the symptoms she's been having, this is what's going on. And then I create a plan right then and there. Okay, this is she's gonna need this, she's gonna need B12, she's gonna need some Zofran, she's probably gonna need some Toradol.
What about your weight loss stuff?
So we do also offer the weight loss injections.
Hello.
Okay, get your pick on that.
Okay. we gonna go into that.
Yes.
Okay. Yeah. So I also do injections. So I do everything IV vitamin component. I don't do all the extra stuff y'all be doing. Okay.
Girl, first of all, let me tell you this.
What?
You are just as important to the post-op world as we are.
Yeah, I don't think so.
You don't know how many girls. You know
you.
how many girls are sitting at home right now trying to figure out how to lose weight, how to get within their BMI.
You're right.
You know that is important.
Thank you, because they be making me feel like I ain't that important, y'all.
Girl, no.
Come on now.
I tell everybody we got to call Robin. This is like a situation we need to call Robin.
Baby, it's called Robin. We're going to urgent care, okay? Something about to happen.
Yes. So we do offer the weight loss injection. I have 2 types of weight loss. So the first one is for my girlies who work out.
Not us, baby. She's shading us. She's shading us.
It's an inside joke. Y'all ain't got to know about it. But for my girls who have that stubborn fat and they can't lose it. So we have, it's called a lipo C injection that helps break down your fat overall. It's not just one target area. You're going to lose the weight. The most my client has lost in 1 month with the lipo C injection, I heard it was 12 pounds. That was the most I ever received in 1 month.
She was getting it.
Yeah, she was getting it.
She was at the gym.
She was
one like me. Okay.
Okay. She was at the gym. And then we have semaglutide. That's another one that we offer, but I'm very careful with that. That's the one. It depends if your BMI is pretty high, then we'll be like, okay, we'll create a plan for you. And if you need to lose weight before surgery, some people cannot have surgery without losing certain weight or a certain BMI, or if they go to,
right, yeah,
to a certain doctor that does high BMIs. But we offer that as well, and we create a plan for you. So if your doctor say, hey, I need to lose 30 pounds before surgery, I'll get you right in a month. If you listen to me, I'll get you right in a month.
Keyword listen.
If you listen to me, we go through the carb intake, we go through the protein intake, and then with the injections, I will make sure that you meet your goal. And everyone who has listened to me has met their goal. Now, the ones who didn't listen, that's on you, baby. I try to tell you, I try to tell you this is what you need to do. But you would lose the weight. One is really natural vitamins. One is medication. Okay. So it depends on what goal you want to go. So if you're like, I don't want to be on medication, try the lipo. The lipo C is really good. It's a natural fat burning vitamin. It'll help.
Awesome.
Thank
And so
you.
how can they get in touch with you, Nurse Robin?
So they can get in touch with me at rejuvawellnessbar.com. I know some people can't spell. So REJUVAA wellnessbar.com, Instagram Rejuva Wellness Bar, TikTok Rejuva Wellness Bar. That's the best way to get in contact with us. Okay. And then if you are one of Nurse Fonda's or Nurse Ebony's client, they get first class treatment. I'm just being honest. You heard they say we gotta text Nurse Robin. I'm here the same day.
Same day.
I'm there the same day.
Middle of the night.
Middle of the night, Robin, baby, listen.
She be like, let me pick up my baby from daycare, honey. I'm coming. God,
and the baby
her and the baby.
I'm coming with the baby. Because let me give a little history about how I met these two. Ebony was my client.
Yes.
She had booked me for IV. And
I
she
was
like,
down bad, baby, because
down
I was overworking myself, baby, 7 days a week.
trying to
24/7.
take care of y'all, and these people not taking care of themselves.
Yeah, that's true.
Okay. So I pulled up on her, got her this IV drip, got my girl back. Then she referred me to this beautiful young lady,
Yes.
right? And we've been booty partners ever since.
Okay, hello.
Okay.
Been getting to it.
And I want to
into
say I'm
it.
proud of y'all. I'm
I'm
really,
so proud of
really
you.
Proud of you
proud of
too.
y'all. Y'all got to understand, this is two black women who do the same thing, y'all, and they're sitting down making money together. It's collaboration and not competition.
Hello.
Okay, so I just want this to be a motivation for other nurses to be like, you can. They make money. We make money together.
Together, all three of
always.
us.
We
Okay.
make money together.
Always.
And I'd be like, hey, you got time to do a massage? Nah, girl, call Ebony. Okay. I got 2 clients for you, King. Oh, Lord, where she at, Robin? We all make money together.
We do.
Yes, we do.
And that's important, to be supportive of one another. Because I tell anybody, being in competition with each other is only hurting yourself.
Yeah.
Exactly.
Especially out here in the post-op world, because there's so many girls and so many people need you and pulling you in so many different directions. You cannot do it by yourself. When I used to travel to Miami and work, I definitely had a team. The girl who I stayed with when I was recovering, Nurse Jazz, shout out to her, she loved to cook. So when I started going to Miami, after that, I would use her to do all my meal preps.
Wow.
There's another young lady. Her name is Tamara. Tamara's a nurse practitioner in Miami. Tamara who did my IV. So, of course, I kept her information. She would come do all my IV drips for me whenever I would travel to Miami and take care of girls. You have to work as a team.
Yeah.
There's too much that needs to be done.
And
You
it's too
can't
much,
do
it's
it
too
all.
much money. It's too much
And
money out
it's
here.
definitely enough money for everybody,
Yeah,
baby.
for everybody.
Everybody
It's a
to eat.
$1 trillion industry.
Yes.
Okay.
Come
I'm just
on
trying
now.
to get a little piece of the pie.
That's it. Just a little bit.
I just need a little something.
And I want to, excuse me, I also wanted to just circle back onto the injection parts. So a lot of us have a vitamin D deficiency.
A lot of black
Ooh,
women.
I definitely
and
do.
can I explain this?
Go
Can I-
ahead, girl. Go, girl.
I love educating people. Okay, so as black women, we have a lot of melanin. And as we have that, it prevents our skin from absorbing the sun, right? The sun is a major source of vitamin D. So with that being said, we are unable to just take in that vitamin D because of our skin color. And not only that, a lot of us are lactose intolerant. So you also need calcium to synthesize vitamin D to store it in your bones. So
Ooh, you better be smart,
Did you hear
friend.
the science behind that? Did
baby,
you
I
hear
should have been
that?
an educator.
Nurse
educator
educator.
coming.
So she is 100% right. That's exactly what it is. So a lot of us, this story I had shared it on TikTok. This girl, the doctor diagnosed her to be depressed. Right?
That's
the
what it
first
feels
thing.
like, though.
That's what it feels like. You feel
That low
depressed.
vitamin D, that's what it feels
It
like.
makes you feel like you don't want to do anything.
Can't-
You're low on
can't do
energy.
nothing.
You're really like not being
No
your best.
motivation.
No motivation to do anything. So the first thing the doctor did, instead of getting her lab work, get your lab work. He said, "Okay, you're depressed," because he just heard her and said, "Okay, you're depressed. I'm gonna give you this medication and you're gonna start it." And one nurse practitioner told her, "Listen, get your labs checked first and see what's going on." So that got the labs back. Vitamin D was low.
Yeah.
Yeah.
She
That's
said,
me. That's me.
She said it was extremely low. So she said instead of taking the pill, she did injections because we need to get it back up. She said within the first treatment, she felt like a different woman. First treatment, she said, "Oh my God!" And they were about to put her on some meds, depression meds.
Wow, that's crazy.
You know. So I just wanted to share that, just the overall for wellness, to be like, you guys, please just get your lab work checked. Look at other wellness options instead of going to medication all the time. we're here to help you, and we're here not
Yes.
to harm you. We left the bad side to prevent you from going to the bad side.
That's it.
Okay, then let me hear that. Let me say that again. We left
Okay.
the bad side to prevent you from going in the bad side.
That's
Okay.
right.
Okay, we seen. Okay, baby, if you would have did this, you wouldn't been here.
If you would have
That's it.
took a little bit more care, watch what you eat, exercise just a little bit.
Yeah.
You would have been okay.
Well, everyone, this has been a great session,
It has.
especially to be our first one.
I did that.
It's so nervous.
We are off to a great start, right? We're definitely off to a great start.
Yes.
However, we would love for you all to follow us on Instagram,
Of course.
TikTok, Facebook, all those wonderful
YouTube.
things. YouTube, the Plastic Surgery Perspective.
Yes.
And we'll be back with more doctors and more information. You all
See
have
you
a great and
soon.
wonderful day.
Thank you.
Bye.